All right, now we go to a short axis view, not necessarily of the hip joint, but more to find all the different muscles in the anterior part of the hip. For the long axis view, we were perpendicular to the crease of the hip. Now for the short axis view, we can start in the angle of the crease of the hip and then have a look at the screen and try to find the head of the femur. So there's a sharp bony line with a bit of cartilage on top. So now I know where I am, and at first I'm gonna look for the psoas tendon, which should run just above the hip joint. This is the tendon. It can become hypoechoic or hypoechoic. If I will move more medially, there's the artery. So this is all the psoas complex with the psoas muscle and the iliacus muscle more to the lateral side. If I would move more medially, there's the vena from the femur. And if I would continue this way more medially, you can see the bone go up of the pubis, and right up there is the pectineus muscle. We're not gonna follow them any further, but we're gonna look for the rectus femoris. So we need to go up and find the anterior inferior iliac spine. So there's a hypoechoic line with acoustic shadowing underneath. If I go up, the tendon above it will decrease. If I move down, the volume of the tendon will increase. As soon as the bony line is gone, I should have a good view, but if I go a bit further, there's still a bit of acoustic shadowing because of the indirect tendon. Now if I follow the rectus, the muscle is gonna grow slowly and slowly. So we still have a tendon, but now the muscle covers the whole screen. I go down much further, and inside the rectus you will find the central tendon. It's a soft tissue landmark which tells you that this is the rectus. I can follow it up, follow the central tendon. So up we go. The size of the muscle decreases, it lowers itself a bit. There's the first shadow, but there's no hyperechoic line. So this is because of the indirect tendon of the rectus femoris. If we go up, the shadow might become a bit less. And if I continue to go up out of the deep, another hyperechoic line appears, which is the anterior inferior iliac spine with the rectus insertion on top of it. So we go to a long axis view. I rotate my transducer. There we go. So on the left side is the bony line that you recognize from there. You can see the tendon. If you try to follow it, there might be a bit of acoustic shadowing as well, which is okay. We just try to follow the tendon, and the muscle will arise and continue to grow the further you go. So now we're in the long axis view of the rectus. We go back to short axis again. Follow the rectus. There we have the bony line with the acoustic shadowing. Now if we continue up, we end up on a very superficial hyperechoic bony line, which is the anterior superior iliac spine. And from there we have a short axis view of the Sartorius, which goes medially, and the Tensor fasciae latae, which goes lateral. We'll start with the Sartorius. So I go down maybe 5 centimeters, just like this. You can make this move a bit quicker, just to get an idea of what is Sartorius and what isn't. So I make this move, I go down. At this stage, it's quite hard to distinguish the Sartorius, but if I go a bit further, there appears a muscle belly and another one. So one is the Tensor and one is the Sartorius. So I go up again, follow the fibers, go down again. So now we follow the muscle that becomes a triangular shape. go. And it moves towards the femoral artery. And if you look at my transducer now, from the lateral side, I'm moving more medially. And if I would follow the Sartorius even further, it's going to crawl over the artery until it's almost completely medial to the artery. So this was the short axis view of the Sartorius. So we go up, 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 up. Follow it all the way until it ends right there. And now we go more laterally. So first I go down just a little bit and see what happens. It's around 5 centimeters. And it might be just a bit of a quick movement you make while you look at the screen. So we have a superficial bone that goes down and a muscle that arises. So now we focus on the muscle that arises on the lateral side. It will become quite big. Also have a little bit of a triangular shape. I continue to follow it. And quite soon it's already decreasing in size. Decreasing in size. Need a bit more gel. It's decreasing in size until it disappears. Right here. In a hyperechoic structure, which is the ITB. So from here I go up. You can see the muscle pattern start. The muscle becomes bigger and bigger and bigger. And if I follow this all the way up, it becomes a bit triangular. I follow it up all the way until its origin on the spine.